Welcome back to the podcast Champions with David Peavy. Today is so I get asked by my boss who our next guest will be, and I was thinking I gotta have some women in this sport, in our industry, who have been impactful, who I respect a whole lot in what you do, and you came to mind right away. You and Britt are two women that I deal with a whole lot, and I love surrounding myself with elite people. And this person on the podcast tonight is definitely elite. Dr. Erica Rodriguez. I'm going to let you tell us about you. I have no script. I have no questions that I have pre-planned, but I'm going off of you. So you're going to tell us about yourself, and then we're going to have a good time just having a conversation.
All right. Sounds good. So I own Fourth Quarter Recovery, or founded it, and it's just a sports physical therapy and recovery business. So I work with elite athletes anywhere from high school to professionals. And just speaking off kind of how I know you, I started working with Anthony Black when he was a junior in high school, and then kind of met you through him, and then got tied into a lot of the Duncanville players, and the rest kind of just took off from there.
Yeah, I can just say this, the game has changed. The game has changed a whole lot. And being an elite athlete, part of being an elite athlete is recovery and physical therapy. So when I met you and saw the things that you were doing with Anthony, to me that was a no-brainer. And this was before I even knew all the professional athletes that you were dealing with. And then you reminded me that we had met before at the Mansfield Fieldhouse when my sons were working out with a couple NBA guys in the summer, and you were out there doing some work. We met in passing without even knowing it, and after thinking about it, you reminded me of that encounter. But yeah, the game has changed a whole lot. And tell me, when you decided, how old were you when you decided this is what you wanted to do?
Well, when I was in high school, I did just a small internship during the summer with like a sports medicine clinic. And I mean, I always played basketball, so I knew I was like going to go on and play in college. So ultimately, I feel like growing up, everybody thinks like that's what they're going to do for the rest of their lives. But, at that point, I feel like women's basketball was not something that, it was like, okay, go through college and then decide what you're going to do.
Yeah.
And so as far as that goes, I just felt like I wanted to do something that was related to sports. And so I did the small little internship. I was a senior in high school, I think, or about to start. And just to kind of see what it was like. So I was like, okay, this is cool. I have to pick a major anyways, right? Can't major in basketball. So I decided after that I would kind of go down that road. And then I was kind of torn between like, do I want to be like a coach, or do I kind of want to stick with like sports medicine? So I feel like going in, after like getting my basics and stuff, I kind of decided I think I'm going to do like coaching. But then I was like, I don't really want to teach, And after having to take, I think I took like one education class, I was like, no, I'm not doing coaching. And so I switched to, I didn't really have to switch my major because I was still doing exercise sports science, but I had to add like a biology minor because I needed a bunch of different courses and prereqs to even get into physical therapy school. So that's kind of when I switched and started pursuing that. But I also, too, when I was playing in college, I tore my ACL and I had to go through a bunch of rehab too. And I already knew that I was kind of interested in it, but then having, I spent every day in the training room, like rehabbing for like almost a year, right, to get back. And I spent a lot of time with my athletic trainer in there. And then I guess just seeing that process and realizing like how difficult it was, and like mentally, physically, I just knew that the person that helped you get through that was very important. And so, after going through that, I guess is when I switched everything, like my major, and decided to pursue physical therapy. So after my bachelor's degree, I applied to physical therapy school and got my doctorate in that.
So how long have you been doing it?
So I graduated with my doctorate in 2014. Okay. So I've been doing it since then.
All right.
But I started out in like a orthopedic sports clinic, and I did that for, several years until I started my business in 2020. Mm. But even when I started in 2020, it was just on the side. Like I worked in the clinic like 40 hours a week, and then I would go and pick up guys or whoever after that, like outside of those hours. So I was working like really hard for probably about 8 months. I did both.
Right.
And, my first opportunity was an NBA player that it was during bubble season, and he wasn't actually going to go, or he couldn't go. So he wanted somebody to kind of come out and work with him, do a lot of injury prevention type stuff several times a week. And, this person that was helping him, like his assistant, he went to high school with a guy that I knew, and he kind of asked him like, hey, do you know somebody that would be good at this? And that guy was like, her, like, yeah, I would recommend her. Right. So that's kind of how I got connected with them, and just kind of started like that. And then slowly after that, I got connected with Keontae. And then I kind of took off with like the elite high school. I realized at that level that there were so many elite players in Dallas, and none of them were really doing anything yet. They were all just kind of training and working with skills trainers, playing basketball all year round, but none of them were truly investing in their recovery or their injury prevention. So I knew that market was kind of wide open. And then I realized, Keontae's mom was like, oh, I'm going to connect you with one of Keontae's best friend's moms. Like, she's interested in what you do. And it was Jen. So then Jen hit me up. She was like, hi, I'm Jennifer Black. Like, my son's AB. And I already knew who he was because Keontae had already told me about him, and I saw AB play before I ever worked with him. Okay. Because I was at a tournament watching Keontae play. AB played after, and I realized that was one of Key's friends. I was like, oh, I'm just going to stay and, watch him. So after, getting them two, they were two of my earlier, like, high school athletes, and I realized, like, a bunch of these guys that were top players, like, grew up together, were best friends. So it was really easy, like, after I did a good job with, a couple of them, just to kind of jump in and get some of the rest of these good players. And, that was the beginning of 2021. And then I would say in March of 2021 is when I finally quit my clinic job and was like, I have to try to do this full time. Right. And that's kind of when I decided, okay, I'm going to try to bet on myself here and just quit and see how far I can take this. But at the time I had a decent base of people that I was already kind of building a network. So I knew that in order to see how far it could go, I was going to have to quit and kind of pursue it full time and see if I could make it a full time thing instead of just, in the evenings or on the weekends. So
it's been crazy to watch. I thought that's how it was going. I didn't want to assume, but it's like you got in at the perfect time, with all with that group. I mean, out of the 5 McDonald's All-Americans we had that one year with Keontae, AB, Jordan Walsh, Arterio, and Cason Wallace, I'm gonna assume you saw at least 4 of the 5,
Yeah.
but maybe even 5. But just, I mean, there isn't an elite athlete in the DFW area that doesn't know who you are. And I get talked. I mean, people. One, everybody thinks that you're on staff at Duncanville. That's one. And I get calls all the time, man. Hey, I need a hookup. Like, hold on. There's no such thing. There's no such thing. A hookup means you get in. You know, right now, if you can get in to Dr. Erica, then you got hooked up. But there's no, you know, I can't make a call and say, hey, this one needs this and that. And you pay for what you get. You know, you're getting the best right now. I just started following you. I'm not big. I don't know what I'm doing on social media, but watching you on, I think it was TikTok. I saw you on TikTok, right? You're on everything.
Yeah, TikTok.
You're on everything.
Yeah.
But watching the different athletes, and it's crazy. It's like, dang, you're working with him? Oh, you're working with him? You're working with him? NFL guys, NBA guys. Of course, all the top high school kids that are going to have a good chance of making it in the NBA and the NFL. It's cool. It's fun to watch what you do, and I get to see you a whole lot. A lot of people know my son Micah plays at TCU, and it's like we run into each other all the time at TCU games. And it's funny, after the game, you'll say, you know, before Micah even comes out, what's going on with Micah's left knee? Like, what are you talking about? Like, nothing's wrong with Micah's left knee. Like, he looked a little like he was favoring his left knee a little bit. I'm like, come on, Erica, stop. You know, don't play with me right now. And then Micah comes out. It's like, yeah, man, my left knee's bothering me right now. It's like It's like, man, Erica, you know what you're doing. You know what you're doing. You're great at what you do. I want to know, like, when did you know, like, this is, I don't know. I mean, people throw out the GOAT way too much, and I don't know enough about your industry, but I feel like the people who want to deal with you know, like, I got to get in with her. I don't even know the question I was about to ask, but I want to know, because I got to assume, do you watch film on your players?
Not necessarily. I mean, I will like watch their highlights, or if they post something like that, or if I happen to, you know, miss a game as somebody that I work closely with, then yeah. But a lot of times I see them play in person,
right? Or
I see them train or
you're
practice.
Always in the gym. That's what I mean. You live in the gym. You're following your players or your clients, but they're your players. And that's cool. I mean, that says a whole lot when you follow what they're doing and you try to get to their games. But go ahead.
Definitely. And, you know, with my NFL guys, I'm switching all, you know, on Sunday. I'm sitting there watching most of the games because, I mean, I work with several of the Cowboys, but I also have guys that play on different teams. And so I feel like on Sunday I'm flipping through the channels, like, because one guy's playing now. Oh, I have 2 guys that are playing now. Right. Just kind of how to watch how they play. Like, you know, I feel like I'm pretty well versed in sports. So, but allowing everybody plays a little bit different. So, just for example, if I have an athlete is a football player, but he's super aggressive and hits really hard, then I know, like, okay, like, he has to be ready, like, as far as, like, if he's dealing with something, if I know that they're overly aggressive on how they play, I know how hard I need to push them before we even attempt to go back to that sport or to practice and things like that, just because everybody moves a little bit differently. Mm-hmm. And I think that really helps me understand the athlete, not only as, like, their personality, but also their mechanics and the way they move during a game. So when they tell me, oh, yeah, this kind of, like, bothers me, I'm not overly surprised because I've seen how they move, or I've seen what kind of player they are, and it makes sense on, what they have going on. So I think that, being there and watching them, besides just the support, I feel like a big thing that I do is the guys that I work with or girls, I truly invest in them. And I think that's one thing that sets me apart. I'm not just, trying to gather up every star that comes around. I really want to build a good relationship with them. It helps me understand them. I feel like it truly helps with recovery. It's like, it's a big mental game as well. And so when they know I ride for them and I support them, I think that only helps. And, trust is a big thing too. I have players that come to me maybe after a team doc or a team trainer has said, hey, this shouldn't be a problem. I think you can go back at this date. I have a lot of guys that send me their MRIs and say, what do you think? And, right. Or they ask me I don't think I'm ready. What do you think? And I feel like having that good relationship and trust really allows me to give them my honest opinion, and they value what I tell them.
Right.
Because I am going to be straightforward with them, and I don't really have a loyalty to the team for them to play. My best interest is what is best for my athlete.
Right.
So I'm always thinking long term. If they're young, I'm just hey, if you sat out 1 week, we could be clear of this. If not, it could be something that you could make it a lot worse. So I feel like just building that trust with my athletes is super important. So then when important conversations come up, they know that my opinion is in their best interest.
So tell me, being a female in this, you live in the male world, okay? I mean,
Definitely.
You deal with a lot of football and male basketball players that I've seen. How difficult is that?
It can be challenging. I've never had an issue with my athletes.
Mm-hmm.
I never felt like they look at me and do you really know about, sports or whatever? I think, it helps me that I've played, but I also know a lot about the game, even
right.
football. I feel like some of my NFL guys are I don't know. I feel like sometimes you know more than I do about this. So, because I'll be talking about different players or different teams. So as far as my athletes, I've never felt that, but I do believe there can be a disconnect just depending on the mentality of other people in positions, whether if it's head athletic trainers at universities or even at the professional level, or people that aren't in the industry at all, but they have those decisions on who, their athlete is going to work with. I think that, it's a disadvantage for sure. You really have to overly prove yourself in order to get a chance. And I mean, there's been plenty of times I feel that I've reached out to help at different events, and they're just no, we have our own people. Right. And I'm okay, that's fine.
Your loss.
Yeah, so I just kind of keep it rolling.
Yeah. I think around here for sure, your name is at the top. So I don't think, I would hope you wouldn't, but I know our industry, I know our business. It's not easy. It's not easy for women. And how closely you got to work with them, and you get to see some guys in some vulnerable situations, where they're down and out, they're depressed, they've got to sit, and it's just, I'm glad, knowing you, I'm glad it's you who gets to do it because, I know what you do and how well you do it. But we're not done. But we are going to take a little break to give our sponsors a minute to tell us who has sponsored the first part of this podcast.
Sounds good.
All right. So, we just talked a little bit about you having to prove yourself, in this industry. And I said, right now, you're probably to a point in our area, at least in the Dallas Fort Worth area, that people are lining up. You've got athletes trying to get in to see Dr. Erica. And it's because of, what you've done. The proof is in the pudding. You're getting your athletes back on the fields and on the courts. You're keeping them from getting injured. And we have seen some high school kids go to the pros. Now they have been drafted. I think you had two in the first round this year, one in the second round that you've been working with. Tell me what that feels like, going to the draft and seeing the kids that you've been working with live out their dreams.
Yeah, it was awesome. It was definitely a surreal moment for me, so I can only imagine like how they felt. But I've really enjoyed seeing them grow as people and then as athletes as well. I remember when I started with AB, he was kind of coming up at the time, but he was still kind of getting left out of the picture. I mean, I think he was barely breaking into the top 100.
Yeah.
And I remember specifically, being at the house one time and we were about to do treatment and the new rankings were going to come out. And so I had worked with him for a little bit. I can't remember exactly how long, but it was still in the beginning, first several months. And I remember he was excited to see, because he was like, man, I've been playing so good, and he barely moved or stayed about the same. And I just saw how disappointed he was. And I think he was in the 70s still, 75 or,
right.
And I remember asking him well, what, what's your goal? Where do you want to be? And I remember he told me I want to be a McDonald's All-American. And we're about to approach summer ball.
Right.
It was still in junior year in school, but it was closely approaching where summer was about to start. So it was going to be a big summer for him. And I'll just never forget that moment, asking him that. And then going from that to him being almost right on the edge of a lottery pick was just crazy.
Right.
And, I felt really proud for him. And I just, just knowing that I was just a small part of his journey was awesome. So he's one example that I remember, specifically him climbing while I knew him. So that was cool. Keontae was already pretty good. He was already a really top player. So I feel seeing him be at McDonald's, it was already kind of there when I met him. Or possibly he was in the top rankings.
Right.
But even still, it's still a hard journey, and there's a lot of time.
Right.
They still have to go be a freshman in college, which could change the trajectory, to be honest. And so to see him go in the first round was, surreal too. He was one of my first athletes. So I spent so much time with him, his junior year of basketball before he left for IMG. So I feel we were together almost every week. And so that was a crazy moment. And then, then also I met Jordan when he was in high school, but I really didn't start working with him a lot until after he got back from Arkansas. So when they got knocked out, I was over there almost every week, just helping him kind of prepare for the combine and things like that. So really to see all of them attain that is crazy, because it's a 1%, and just knowing them from a younger age and seeing them develop into that was just something that I'll never forget. And actually getting to be there was awesome,
right?
Because hearing their name called, I just remember waiting okay, who's gonna go first, So that was a really cool experience, and I love stuff like that because I love sports. So the fact that, I got to be there for more of a personal reason because I know them, and, it was just another awesome thing that I got to do to just be there for support as well.
Yeah. And I got to spend some time, we were around the same places and the same people a lot. And it was cool, sitting back as a coach, I've never thought about physical therapists and, people who work, and it's like, man, you got to be feeling the same way. These are your kids, just like there are kids as coaches. We might spend a little bit more time with them, but the things that you've done to make sure, I saw the improvement. Of course, I got to see Anthony's journey from the time he was starting his freshman year till now. And I got to see his improvement and the struggles and the rankings and all that other good stuff that you were talking about. But I also saw what it looked like before you were in the picture, and then once you got into the picture, and the things you were doing to help him recover and help with his movement. Just certain things that you saw, and certain exercises, and watching him get more explosive. I don't think it's a coincidence. Of course, a lot of it is genetics, and him getting as tall as he's got. Yeah. But the burst that he got after you started working with him, that I don't think that's a coincidence. And then getting back, when things are nagging, when ankles, his ankle issues, and you getting his ankle stronger and allowing him to stay on the court his freshman year, allowed him to get drafted number 6. If he doesn't stay on the court as much as he got to stay on the court, so you got to take a little bit more credit than you probably give yourself for a lot of these athletes that have achieved the things that they have. You played a big part in that, and it's cool. We all got emotional, at the draft, and had a good time at the draft parties. We got to celebrate with them and with the families, and it was good times. A lot of good times. And so now what? Now what's next for you? What are your plans on? I know you've got your fourth quarter recovery. Are you the only employee, or you got more in the works? Are you trying to grow it? What are you trying to do with what you got going on?
That's a good question. I don't think I have like a set answer for like what I want it to look like in 5 years, but yeah, right now I'm doing everything. I do the social media, I do the treatments, I do the scheduling. So it is a lot, because when I'm not treating, I'm catching up on documentation.
Let me say this real quick. A lot of people, people who know, you come to them.
Yes.
You come to them, which is awesome. Many times I walk in the door and there's Erica with her table set up, working on AB, and Beckham sitting there waiting to get his toes looked at, or whatever he's got going on right now. But that's big. That you don't have to go to an office. You come to them, which is awesome. But I know that's that's a lot going on for you and your schedule. But my bad, go ahead.
Yeah, definitely. I realized as well that not so much the elite high school, but the professional players, they prefer convenience and also privacy. So even if your office is 10 minutes away, they're going to prefer for you to come to them. Like they just don't want to do that extra drive. Like even 10 minutes there, 10 minutes back, what if there's traffic? So I feel like I saw that was a good option, as far as like traveling to like the professional. I knew that they would be in a market for it, just because when I started, that's kind of what I had in mind. And then I just kind of added the elite high school in when I saw that nobody else was, kind of going after them. But then I realized, a lot of these high school kids have such busy schedules, or they need stuff outside of hours that a normal office would be open. So, that really helped me, build that way as well, just because a lot of places you have to go to them, and I pull up to everywhere, practices, gyms, like, wherever the athlete is allowed to be with me, I'll go there. So I don't just necessarily go to their house. Like,
well, I can say this. I mean, for the elite high school kids, they don't have to miss school.
Exactly.
That's huge. What doctor's appointments, and a lot of parents don't want kids missing algebra, or their school classes, and so they'll take them during practice, because they still got to get to the doctor before 5 o'clock or whatever time it is. So that's awesome that kids can have their whole day, go to practice, and then I've seen you sit and watch practice to see how your player is moving, and know what they need to be working on, or some different exercises. It's awesome that you leave us with exercises for them, so we can take the exercises that they need to be working on. I can hand that over to one of my coaches to make sure, that kid gets that 10 minutes every day before practice. So it's cool. I mean, I think that that sets you apart for sure, and that, puts you in GOAT status. But go ahead, my bad.
No, you're good. Yeah, I feel like the mobile aspect and not having them miss things is super important. One person that comes to mind that played on your team was Ron. Like, I was there early.
Right.
Like, we started before 7 o'clock in the morning sometimes, and sometimes we do that a couple times a week during season. And we do his full session before he had to go to school.
Right.
So he had to get up early to get this in, but at the time, that's sometimes one of the times that it fit in his schedule and it worked. So I just remember working with him like before school, like every week, and that I know was a huge plus for them, just, to get it in where he didn't have to miss school, because he already missed so much school for other things,
right.
Other games, all-star games, so the least he can miss school, the better for him. And then just going back to, just how we were talking about AB's performance, I think my biggest thing that I needed to help him was when he was that junior year before summer league started. It was a very crucial summer for him. And so we couldn't afford for him to have an injury during that time where it blocked out some of that summer. Like, he needed that in order to even get the offers that he wanted. So I feel like that's one thing that I knew I had I knew that from the beginning with him, is like, he has to stay healthy this summer. This is a huge summer for him.
Right.
And just being able to play every game, and then, kind of carrying on with what you said, moving into Arkansas, he played like almost 40 minutes a game. Like, I think he played like 38 or 39 minutes
crazy.
Average.
Yeah,
and,
crazy.
For him to be able to have that durability.
Right.
He is younger, but still, that is a lot of minutes, and for as hard as he plays,
right.
To stay
the
healthy.
SEC in minutes.
That's crazy.
That is nuts. Yeah. And that's because of Dr. Erica. Yeah. That's crazy. Yeah, for you to say that. I didn't even think about how many minutes that dude played. Can't do that when you're hurt. And he was banged up. But I think because of all the work that you did beforehand, it kept him on the court. Yeah. And then, a lot of people don't know this, and you did travel to Arkansas sometimes to go see him and treat him. How often do you do that with your professional athletes? Do you get on a plane and go see them?
If they are in a city where they don't have a lot of resources, like say that, like for my NFL guys that play in different cities, they will ask me to come up. But if they've been established at that team for a while, a lot of times they'll use their team resources as much as they can and maybe find like an outside, person. But for the most part, I'll travel if they need me to. Right. Just like kind of like I did with AB, a couple times. I went up to Baylor to see Keontae as well. So he was kind of closer, though, so that was a little bit easier. But, yeah, if athletes need me to travel, I'll go with them.
I think for that Baylor, I think you even treated AB in the hotel when we came when Arkansas came and played Baylor, I believe. So yeah, it's been cool. Just watching. How young are your athletes getting now? I know, shoot, you got a freshman.
Yeah.
And,
I feel like I started with Beckham too before that.
Yeah, you did.
Probably 7th grade or 6th grade.
He got tied in. I don't think you had a choice when you came over. He was gonna jump on that table too. Are you starting to go younger? But I mean, I don't want to speak for you, but I would guess. I mean, you have so many clients now. It's kind of hard to add more right now. How often are you adding clients?
So, I mean, right now I'm pretty busy. Like, I really don't have really any open slots that are like in the evenings, like as far as after school, after practice, because I'm in season with my Cowboys players. Well, they don't get out of practice. I utilize their off day, which I see them earlier so I can get other athletes in the evenings. But, they get out of practice just like everybody else does, and it's in the evening. So that kind of limits, who I can see unless they can be seen in a different hour. So, like as far as like some college players, sometimes their days are a little bit spread out or a little bit earlier. Like when I work with Micah, we kind of work in the middle of the day, which is a good time for me because, everybody's still at school or in practice at that time. Right. So college guys are kind of in the middle, but for the most part, when off season and summer hits, like it's a lot easier because the schedules can be, start in the morning and go throughout the whole day. But yeah, right now it's like it's hard to get in for an evening session because I'm pretty booked.
Yeah. Well, you stay busy, you stay elite. Just want to put this out there. Erica is not on staff with Duncanville, but everybody assumes that because you've dealt with a lot of our high level basketball players, and your shoe game is always on point. So people think, yeah, she's got to be with Duncanville because of her shoe game, and she's always around. But I appreciate you. Hopefully we can do this again. I'll get some more updates from you. But go ahead and put your socials out so everybody knows where they can find you.
Okay, I'm at Fourth Quarter Recovery on Instagram and TikTok, and you can kind of get my contact information if you want to get a hold of me through my Instagram. Good luck getting in. But if you can, it's definitely worth it. She's the best. Love you. Thank you.